Hello, today I'll be talking about the Mbeubeuss landfill. The purpose of the presentation is to educate my audience about the Mbeubeuss landfill, expose them to the detrimental impact the landfill has on human and environmental health, and provide recommendations on how to protect population and environmental health in order to improve the living conditions of people living in and around the landfill, and providing recommendations in the future on how to effectively dispose of waste management in Senegal. This is a list of the topics I'll be covering in my presentation. Where is the Mbeubeuss landfill? It is located in Dakar, the capital of Senegal, and it is a landfill that is located 27 kilometers away from the capital. It is located in the territory of the Pekin city, and the Mbeubeuss landfill is an open landfill that causes both air and soil contamination in the Malika district where 17,000 people live. What is unique about this site is that the landfill is home to the waste picker community, who sort through the garbage to earn a living. Currently, there are about 3,000 waste pickers who are exposed to various health risks, with a particularly strong presence of women and children. The landfill has been in operation since 1968, and in 2007, it was considered an environmental disaster. So what is the problem? With the human population rapidly expanding due to industrialization and urbanization, we are contributing to a large amount of waste production. Solid waste management has a global environmental impact, and so is managing waste, which can be very costly, especially in low and middle income countries. Solid waste contributes to air, soil, and water pollution. Solid waste generation is also strongly correlated with greenhouse gases. Here is a chart that compares various countries with solid waste generation. For example, in the developed countries, we account for 40% of global waste generation, compared to 37% for developing countries and 23% for underdeveloped countries. A high GDP per capita income in developed countries is also correlated with high waste management. For example, in the US, the current level of generation is about 0.64 million tons per day, followed by Germany with 0.14 million tons. India is currently the highest producer among all developing countries, with a daily average output of 0.5 million tons. In the underdeveloped world, they face the issue of improper waste management due to the lack of infrastructure and improper way of managing waste. Here we see that Mbeubeuss receives more than 395,000 tons per year of household solid waste. This is a slide comparing the population size between the US and Senegal, beginning from the 2000s and projected into 2050. As you can see, the US population size is increasing at a very rapidly pace, where in 2000 it had a population size of 282.2 million, and in 2050 it is projected to reach 438 million. Senegal, on the other hand, in the 2000s had a population size of 9.8 million, and in 2050 it is estimated to reach 34.3 million. In this pie chart, we see the breakdown of the waste that is dumped in the landfill of Mbeubeuss. We see here that fine waste accounts for 54.1% of waste, followed by organic waste with 24.3%, plastics 9.6%, papers and cardboard 8.8%, and metals 3.2%. All the waste that is produced is in an open air landfill, which has various environmental and human health impact. For example, the waste contains heavy metals, which exposes individuals to severe conditions that I'll be talking about in the next slide. The health impact. Since there is no other treatment of the waste other than the recycling that is done by the informal waste picking community, we see the groups of individuals who are at risk. 10% of the workers are children under the age of 13, 25% are women, and 65% are men. Working in the landfill has various health impacts. For example, we see an increase in prevalence of diseases such as malaria, gastrointestinal disorders, bronchitis, and asthma for residents living near the landfill. On the next pie chart, we see levels of lead in children living near landfill versus a control group that Cabral and his team assessed. Levels of lead were higher in the exposed site versus those in the control site, which you can see respectively in the chart. As we know, lead results in neurological and also physiological delays in children, which has serious implications for their health outcomes. To conclude, although the Mbeubeuss landfill poses a risk to both human and environmental health, it is a land of economic opportunity because it provides the community with ways to support themselves and their families. This extensive recycling in the landfill has converted trash into money to help the community that has led to a form of sustenance. So they are breaking down this trash, which is in a way cleaning up the landfill. However, it has these negative impact as it contributes negatively to their health. The problem is very complex and will require an innovative approach. Recommendations. It is really important to strengthen the partnership with the African Institute for Urban Management in Dakar with the landfill community in order to address immediate health needs. Similarly, it is important to support environmental cleanup projects so as to limit the number of waste that is entering the landfill so it doesn't cause unnecessary deaths and contribute to detrimental health impacts. Lastly, patience is needed in order to establish dialogue with the landfill community. Remember, for most of these individuals, this is their only way that they are able to support themselves. And these are my sources. Thank you.